I'm Brian Thompson. I'm the CEO of the Dalhousie Medical Research Foundation, and I've just recently celebrated a milestone. It's been 2 years that I've been working with the foundation, and I've had an opportunity of working at some of the larger universities and a few foundations across the country, and I have to say I'm consistently impressed with the caliber of research that's happening right here in Nova Scotia and in the Maritimes. We have a really unique research ecosystem in Nova Scotia and the Maritimes. I haven't seen collaboration like we enjoy in the research sector here in the Maritimes. It's a large enough community to really matter, small enough to really make things happen, and there's an appetite from both a provincial government perspective, public and private perspective to really join forces and tackle some of the most prevalent issues in the healthcare system. In addition to the unique research landscape, we also are noticing that there's an evolution, and quickly the landscape is changing, and we're seeing this shift in paradigm, really going from isolationism in terms of research to much more interdisciplinarity, and a sense of how do researchers collaborate. How do we create efficiencies between researchers, and not just locally but across the country. So one of the fantastic outcomes of this research, the collaborative research environment, has been the creation of a body that's called IRIS. So it's the Integrated Health Research Innovation Strategy. And this is a group of stakeholders from both government, academia, soon industry, looking at how to address the most pressing health research issues to improve health delivery, not just in municipalities, but really in the countryside and areas that are a little bit more remote. Prior to the creation of the IRIS group, my predecessor had started working on the development of a consortium, a fundraising consortium. So today, almost 2.5 years later, the IWK Foundation, the QE2 Foundation, Dalhousie University, as well as the Dalhousie Medical Research Foundation are working together, not just on one particular pilot project, but it is a vehicle and a venue really to vet the projects that we are working as individual organizations, and how can we come together to really promote what it is that we're trying to accomplish. So we see projects such as Profile, and this is a specific project where we have expertise in the Maritimes from an ethics and modeling, cancer modeling perspective, but this is going to be across the country, establishing nodes where information can be shared, samples can be shared, really dealing with rare childhood cancers. Another great example of how we're really collaborating is the creation of the cores. And I know that the Dalhousie Medical Research Foundation played a key role in establishing the cores. And this is really a series of equipment and labs that are accessible to multiple researchers. And this also creates synergies that otherwise wouldn't exist without this kind of a model. This is an incredible time to be involved in health research. We are seeing an alignment of government, of academia, of research, unparalleled, that is really forging a new path in terms of how we're treating some of the health research issues that face us. And I think that based on this shifting landscape, we're going to start seeing some real tangible impact that is going to make a remarkable difference. In 2, in 5, in 10 years. And that is going to improve and change people's lives.